The title of this talk is The Importance of Identifying and Replacing Inferences in Generalized Anxiety Disorder. Generalized anxiety disorder, or GAD, can be a challenging condition to treat. There are several aspects of GAD that make it challenging, and one is the presence of anxiety in multiple domains of life, such as anxiety on the job, in school, in interpersonal relationships, in one's spiritual life, and so forth. A combination of Rational Emotive Behavior Therapy, or REBT, and insights of evolutionary psychology can prove to be helpful. Both REBT and evolutionary psychology view the perception of overwhelming threat as basic to developing and maintaining GAD. For example, in REBT, the conceptualization of an emotion involves identifying the following. 1. The aspect of a situation or event that is most related to the anxiety. 2. The cognitions present with anxiety. The two most relevant types of cognitions are inferences and beliefs. Inferences are those cognitions or thoughts that attribute meaning to a situation, event, or state of affairs, whereas beliefs are cognitions or thoughts that evaluate the situation. For example, in the case of someone with anxiety, the inference about the situation will be that it is a threat to one's safety, health, comfort, or self-worth. The beliefs would involve a combination of some or all the following dysfunctional thoughts: A. That the threat must not occur. B. That the threat is awful or horrible. C. That the threat is overwhelming or too much for the individual to handle. D. That due to the threat, the individual is globally negative, inadequate, etc. Others are globally negative. The world is globally negative, and so forth. 3. The action or behaviors the individual exhibits vis-a-vis the threat. Behaviors such as attacking, withdrawing, isolating, avoiding, and so forth. In the case of anxiety, the inferences of the individual involve attributing threat to a situation. In the case of generalized anxiety disorder, the individual infers threat to multiple domains of life or numerous situations. Therefore, the anxiety is said to be generalized. The typical actions or behaviors exhibited by the anxious individual are forms of avoidance. By avoiding the situation to which overwhelming threat has been inferred, the individual experiences some relief. However, the individual continues to experience the world as saturated or filled with threat. In other words, the narrative the individual has about multiple situations and domains of life is a threat-saturated narrative. Such a narrative, when linked to avoidance behavior, yields an individual who has created a small world filled with pain rather than an expansive world with challenges linked to proactive behaviors to address the threat as effectively as possible. Evolutionary psychology posits that the primary function of the brain is survival, not truth, but survival. There are two attributes that can be made to support survival, and they are: 1. That a particular perceptual pattern in the environment is one of threat, especially overwhelming threat, and 2. That a particular perceptual pattern in the environment is one of resource, such as food, that supports survival. The brain, however, makes errors in the identification of perceptual patterns and thus may perceive an environmental pattern as threat, when it may not be a threat, or perceives an environmental pattern as resource, when it may not be a resource. However, the brain is biased toward perceiving threat when there is not a threat, because making an error of this type, while it may cause the individual fear and anxiety, it supports survival. On the other hand, if the brain wrongly perceives an environmental pattern as a non-threat when it is a threat, there is a greater likelihood for experiencing pain, or even death. Thus, the brain's bias is to see environmental patterns as threat. Early in the evolution of humans, many, if not most, perceptions of threat were real threats to life, such as large animals, hostile tribes, polluted food, etc. In contemporary advanced cultures, individuals are largely protected from many of these real threats through adequate housing, health laws, healthy food that is readily available, etc. However, our brains continue to attribute threat to the environment, and in light of the brain's bias toward perceiving environmental threats, many non-threats are perceived as threats. Examples of such are anxiety about failing an exam, the possibility of being judged negatively about one's performance, a poor credit score, and so forth. So we can say that the mismatch of the current evolved brain, and its mismatch with the complexity of advanced cultures, contributes to perception of overwhelming threat across domains of life and multiple situations. So what? Well, in treating individuals with generalized anxiety, it is helpful to identify the inferences of threat the individual makes, but this must be particularized, which means that it is most helpful to get as precise a statement of the inference of threat from the individual as we can. For example, if an individual experiences anxiety about performing in front of others, it is not enough to say that the inference is one of threat. One would need to dig more deeply, and in so doing might identify the particular threat is that the individual would be judged negatively, and this would result in being a failure as a person. Notice the particularity in that inference, as opposed to the generality of the previously identified inference. Once we have identified a precise inference, it will be much easier to identify the associated dysfunctional beliefs and the actions or behaviors taken by the individual. For example, in this case, we may find that the individual refrains from performing in front of others unless they know the individuals and have evaluated them to be fully supportive and safe. This may result in avoiding performing in settings that might yield greater valued rewards of different types. This example involves identifying the inference of threat in just one situation or perhaps one domain of life. But in generalized anxiety disorder, it is important to identify the inferences of threat in multiple domains of life. Why? Some individuals may find it challenging to generalize the learning in one situation to diverse situations. If we can help the individuals perceive what was once an overwhelming threat as one that is really a manageable threat, or even a manageable threat with opportunity, the individual may improve and experience life as less threatening, and the narrative of the individual will be one of manageable threat with important opportunities in life. In REBT, not only would the therapist work at the level of the individual's inferences, but also help identify and replace the dysfunctional beliefs the individual has about the perceived threats. This combination of inferences may prove very helpful with clients. Evolutionary psychology offers other possible powerful interventions, but they will be discussed in an upcoming video. Thank you for listening to this video. Please consider subscribing to the REBT Education and Training YouTube channel. Have a great day.